been concern expressed about measures in the budget which would affect public hospital funding, and we've had several state governments hand down their budgets, and some more are due in the next month or so, where state governments are indicating that their health budgets and their hospital funding is under severe pressure. What do you think might be the ramifications of those funding pressures?
Yeah, so I have a lot of concerns from the federal budget in terms of the funding of our public hospitals. This report highlights the fact that median waiting times for elective surgery have increased from 34 to 36 days. We've also seen improvements in emergency department performance, again driven by the targets that were set under the national partnership agreements. But they're still a long way short of the targets that have been set for the various jurisdictions. And the reason that people are having trouble meeting these targets is because the capacity of our public hospital system is not there. So that's a real problem for elective surgery, but also emergency department performance, because where emergency departments do well is in the patients that don't have to be admitted to hospital. They can get those treated and diagnosed and out of the emergency department within the 4 hours. But the ones that have to be admitted to get to an appropriate bed in an appropriate part of the hospital, that's where performance suffers. And that comes down to an issue of whole of hospital reform, but also an underlying problem with the capacity of our public hospital system. Now, under the federal budget, there are a couple of aspects that are of concern. First of all, the National Health Reform Agreement, which guaranteed funding to the states, which ended the blame game between the federal and state governments for funding our public hospitals, it ends. And so the commitment that was there to match the states in terms of growth funding no longer exists, and that means less money going into our public hospitals. The reward funding that was there for the various jurisdictions for elective surgery and emergency department performance, $100 million, has also been cut. And now we have the government saying that they will fund public hospitals for the states from 2017 using CPI plus population growth. Now, current population growth is about 1.7%. CPI, of course, is quite low as well, around the 3% mark. So, funding public hospitals under that sort of formula means that there's going to be a significant shortfall when you look at the growth of public hospital funding around the various states and territories. And that might be an issue particularly for the smaller states who don't have the economies to get the revenue that they need to support their public hospitals. Now, at the end of the day, we're not really interested in the blame game between the state and the Commonwealth. What we're interested in is patient outcomes and being able to provide treatment to patients, and that's where our concern lies. The other aspect of the federal budget when it comes to public hospital funding, and it goes to the heart of sustainability of the healthcare system, was moving away from an activity-based funding system. Now, ABF was all about trying to get a more efficient healthcare system, looking at issues such as unwanted clinical variation and the ways that we perform procedures to see if we could get the most efficiency and use our resources as best we can. Now, to go away from an activity-based funding type program, that means that not only have we wasted an enormous time and effort in terms of getting that program to where it is now, but of course we ignore the benefits in terms of the sustainability and trying to reduce the requirements for funding of our public hospital system going forward.